I'm known internationally as a hot flash researcher. My name is Janet Carpenter. I'm a distinguished professor and an endowed chair at the IU School of Nursing. I started off as an oncology nurse. I was interested in the symptoms that people have because of getting cancer treatment. And one of the symptoms that people were having are related to hormonal changes that they experience. And so, for example, women with breast cancer were having a really difficult time with menopause. They had an early menopause, they had a rougher time during a regular menopause, or they re-experienced menopause at a later age. And I had been an oncology nurse for a number of years, and I didn't know much about menopause. And when I looked in the literature, there wasn't much that we knew. And so I started my interest in menopause in breast cancer patients. And then because of that research, I started doing work in healthy women. My research has helped nurse practitioners as well as physicians help women at menopause. They can have better conversations with women at menopause around what we know works versus what doesn't work to get rid of their hot flashes. I think the work that stands out to me is the work that I did with a large national network. It was called Ms. Flash, Menopause Strategies, Finding Lasting Answers to Symptoms and Health. And we had funding from the National Institutes of Health, and we looked at all kinds of different treatments for menopause symptoms. And that work has really changed the field. It's been incorporated into 2 different sets of national guidelines that are available for healthcare providers to understand what works and what doesn't work, so that when they meet with patients, they're able to counsel them a little bit better about what treatments might be effective. So I feel like that work has made a big impact on clinical practice, and that's really what I set out to do when I got into research.